Singapore is boosting its vaccine strategy to prepare for the next big pandemic. Among the measures are plans to secure early access to shots against pathogens with pandemic potential and investing in research and development. Also manufacturing vaccines right here. Howdy Ong tells us more with this package.
As Singapore takes stock of its response to the COVID-19 pandemic, it's also had to add up the cost. And at last count, about 15% of all COVID-19 vaccine doses Singapore ordered has expired. That's at a total cost of $140 million.
Because we deliberately over-procured to mitigate the uncertainty of selected vaccine candidate not working and the possibility of supply chain being disrupted, there would be spare vaccine stock, which will expire.
Mr. Ong adds that nearly 25% of all ordered doses are likely to expire in the coming months before the situation stabilizes. But that's the price Singapore was willing to pay to stave off catastrophe, an insurance premium of sorts.
Before vaccines were available, we had to resort to a circuit breaker in April 2020 to contain the pandemic. The 2-month circuit breaker cost us about $11 billion in terms of GDP loss. And we spent close to another $60 billion over 2 financial years to cushion the hardship for businesses and workers, and not to mention all the heartaches and difficulties families had to go through.
As part of its vaccine strategy moving forward, the government will maintain adequate stock of COVID-19 vaccines and a network of vaccination centres for rapid response. It's also in talks to secure early access to vaccines against other pathogens with pandemic potential, like the flu. In the pipeline as well, investing in vaccine R&D to strengthen pandemic research and surveillance, and anchoring 6 vaccine plants in the country.
A crisis forces us do or try new things. What we thought was not possible to do or would have taken years to implement were accomplished in a matter of months because we were pushed by the crisis.
He says lessons learned can mean better hospitals and healthcare systems, more complete laws and more secure vaccines and medical supplies.